So here at the Hip and Pelvis Institute, we take care of a lot of athletes. I take care of a lot of surfers, wing foilers, windsurfers, skiers, runners, and I have a lot of questions over whether you can return to these active sports.
Well, I'm an active guy. I like to do the same sports. And believe me, if it came time to do my own hip, I'd keep doing those things too. So the reality is I'm trying to get you guys back out doing what you love to do, and that's my goal.
So to answer the question, can people go back to these things? Well, a hip is a simple system. There's a fulcrum and there's levers, and if I do a good job of getting everything right, you should be able to go back to these things, and that's my goal. However, you should remember you do have a prosthetic joint after this, and a prosthetic joint doesn't heal at night. It's not like, it's going to rebuild itself after putting a hard day on the slopes. So really, you want to do things in moderation. If you're going to go out and do running, then go run. But I would do it on a shorter duration and shorter intensity than you would, for example, if marathons were your thing. You wouldn't sign up for marathons anymore. Maybe consider doing shorter runs, or runs for the love of running, as opposed to for the competitive nature of it.